afternoon, everyone. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. We're here to give the weekly COVID-19 update. I'm joined today by Chicago Public Schools CEO Pedro Martinez, as well as Dr. Geraldine Luna, Medical Director at the Chicago Department of Public Health. So we continue to have overall very good news in terms of making progress against COVID-19 and specifically the Omicron variant here in Chicago. First of all, at the national level, the whole country continues to be very much in the Omicron surge. Just to put it in some perspective, nationally we're averaging over 200 cases per 100,000 people per day. Chicago is currently averaging 71, and you can see Illinois and nationally are about the same, but Chicago is now about a third of the level of what we're seeing nationally and coming down very well. That said, the whole country remains on the travel advisory. As a reminder, for the fourth consecutive week, we've not changed a single thing on the way we count this, but the number of cases remains very high across the city. And for folks who are unvaccinated, I am concerned, of course, about people taking unnecessary risks with COVID, and that would include travel right now. Variant surveillance. So it is nearly all Omicron. 99.3% of the tests that are being done to look to see what variant we're seeing, not just in Chicago and Illinois, but Region 5, which is the Midwest, are Omicron, and just 0.7% are Delta. We're not really seeing anything else showing up. There's been a lot of attention in the last couple days on the so-called stealth Omicron variant. I want to be very clear, that is just a subtype of Omicron. It has not been named even a variant of interest. We're keeping an eye on it. There's nothing that we've seen at this point that is raising a high level of concern, but please rest assured we're watching it and we'll let you know if there's anything to be interested or concerned about. So how are we doing here? Across Chicago, the last 7 days, we are now back down to averaging fewer than 2,000 cases per day. That still leaves us in the very high transmission category, over 800 does, but this is down from nearly 10,000 a day at the peak. So really fast decrease. You see that our test positivity and our non-ICU capacity have both moved from the very high transmission into the high transmission over the last week. Our positivity is now at 7.9%. Very glad to see that back down in the single digits, down from 14% a week ago. And our non-ICU capacity, we've got 1,216 on average. Chicagoans not in the ICU, still in the high, but out of the very high risk. And then for the ICU, we've got 267 folks still averaged with COVID in the ICU, but that's moved from high to substantial. So a really nice improvement on those highline metrics over the last week. If we look at this graphically, these are our cases, and look at that. The peak daily from January 4th is at almost 10,000 cases, and seeing that huge increase up December to January and then coming back down just as quickly as we've seen it go up is great news. That's what we saw in South Africa. We weren't sure we would see it here, but the good news is we have been. So as I said, numbers remain very high. I don't want people thinking this is over. The risk is not still high, but we are well past the surge and continuing to decrease nicely. Our test positivity similarly peaked January 1, right around 20%. That also has been declining. I know those of you who follow this closely are happy to see test positivity back in the single digits, as am I, and we'll want to see that continuing to drop. I want to highlight one thing that I continue to see posted a lot on social media is this idea that the vaccine is not doing anything anymore. Couldn't be less true. Number one, certainly, we have seen more breakthrough infections in Chicago during the Omicron surge, meaning people who are vaccinated are more likely to get diagnosed with an infection. Most of those are mild, but yes, that is true. However, vaccinated and boosted, both Chicagoans, remain half as likely to be diagnosed with COVID as unvaccinated Chicagoans. There is nothing else that cuts your risk of getting COVID in half. Masks don't do that. Distancing doesn't do that. Ventilation doesn't do that. Vaccination remains the #1 thing, even when the surge is higher, in terms of even helping protect yourself against infection. But more importantly, as we're all thinking about what is this going to look like to learn with COVID, it's about, can we turn COVID into a disease that doesn't cause severe illness, that doesn't put people